I recently had to work up a cardiac arrest where this patient was at home. She did not make it, so we left her home. That's called an 83D, where basically the person was not resuscitated and there was no need to take them to the hospital because they were not going to be resuscitated at the hospital either. So after working up this patient in her house, the family was there, everybody was there. I made it my business to pick up after myself. Pick up the tube kit, pick up the vials, the needles, the suction canister, everything. I used a red bag. You should always have a red bag similar to this one in your response bag so you could put all your garbage. And if for some reason you forgot to put a red bag, use the bag for the BVM, the bag valve mask. That big bag that you have there, use it to put all garbage in there and leave the scene after cardiac arrest or after any job completely clean, every single job if possible. Of course, you have trauma jobs where you just have to get up and go, but if for some reason you have time to pick up after yourself, then by all means do it, especially a cardiac arrest when you're leaving the body with the family. You don't want to leave this person with AED pads stuck to their body. What if they come crying over her and she still has the capnography with the tube in her mouth? That's just despicable. I've seen EMTs and paramedics not be mindful. So if you're watching this video, please understand that every single job you go on, whether it's starting an IV or putting on a gauze all the way to intubating a person, cardioverting them and doing all types of stuff on scene, you should clean up after yourself. Everything. Even if you don't treat this person, all you did was an EKG and you got the little EKG electrode little papers leaving it on scene, that displays lack of compassion, lack of cleanliness. And now that we're on the topic of being clean and staying clean, make sure your ambulance is clean. If the floor is dirty, take 2 minutes and mop that shit. If your uniform is dirty, ask them to give you a new freaking uniform. Your appearances means everything. When you transport a patient outside of the ambulance, cover them with a sheet. Don't leave their body exposed. Respect their modesty. Be very mindful of everything that you do. Any little mess that you leave looks bad on you, looks bad on the profession, looks bad on me, and I wasn't even there. If your bus is dirty when anybody comes on, again, it looks bad on all those previously mentioned people. If you're transporting your patient, they're not covered up, have extra sheets, cover them up, and that way you look more presentable. I've seen people come in with a cardiac arrest, the patient's all like this, you got all the things visible, like, you could have the same patient in critical condition with a sheet over them, the 3 straps over the sheet, and it looks nice and neat. All right, guys, I hope this helps. Peace.